Mabuhay! My name is George Calixterio. I'm a first-year nursing student at the School of Nursing and Midwifery, Edith Cowan University, Bunbury campus. Today, I'm going to discuss first the neurological concept map to understand dementia and its effect to normal physiology, considering the scenario about Mrs. Margaret Thompson's health condition. I will also discuss different preventions for the early onset of dementia, and furthermore, as a nursing student, I will also discuss various health assessments necessary for Mrs. Thompson. Now, I'm going to give you a bird's eye view on neurological concept as map continues to build up. Let's talk about central nervous system. This involves the brain and the spinal cord, which function as the central processor of the body. The peripheral nervous system is composed of cranial and spinal nerve that moves out or into the central nervous system. The central nervous system receives afferent information from sensory neurons and sends information in an efferent or outward direction using motor neurons. So, the peripheral nervous system provides innervation to the body, of which I'm referring to the nerve and the nerve endings involved. It is differentiated into efferent or descending pathway by motor receptors and afferent or ascending pathway by sensory receptors, of which I will discuss in a little bit. Meanwhile, the peripheral nervous system function could be somatic, that regulates voluntary motor control, and autonomic or involuntary, of which is primarily involved in the control of organ system. It will then give signal to the sympathetic nervous system, which refers to the fight or flight, and parasympathetic, which is the rest or digest. For example, the heart rate. However, with the presence of the stimuli, the body reacts to it. This is received by the sensory receptor, which is classified into what type, where it is located, and what is the structure. The sensory receptor, which the afferent or the ascending pathway sends the information through the nerves back to the brain to interpret and back to motor receptors for actions. Understanding this concept will give us idea how the healthy brains react to a certain stimuli. In the case of Mrs. Margaret Thompson, the brain was affected due to the impaired homeostasis in the central nervous system that leads to dementia. What is dementia? According to Arbinitakis et al., dementia is an acquired loss of cognition in multiple cognitive domains. World Health Organization mentioned that there are 55 million people are affected with dementia, which is the effect or result of various diseases and injuries that affects the brain. How dementia changes normal physiology, memory loss, and doing familiar tasks is very common among people with dementia. They are often confused, lost their initiatives, misplace things, and oftentimes have problems with language and abstract thinking. There are also changes in their behavior and personalities. There are only a few indications of dementia that is caused by structural changes, chemical imbalances, and disruptions of essential brain functions that leads to the decline of cognitive functions. However, early detections of this as a future nurse, we can make some interventions to slow down the progress of this disease. Livingstone et al. Mentioned that antihypertensive treatment for hypertension is the only known effective preventative medication for dementia. Reduce exposure to air pollution and secondhand tobacco smoke. Limit alcohol use, as alcohol misuse and drinking more than 21 units weekly can increase the risk of dementia. Reduce obesity and addressing other factors for dementia like sleep through lifestyle interventions will improve general health. And furthermore, specific interventions for family carers have long-lasting effects on depression and anxiety symptoms, will increase quality of life, are cost-effective, and might save money. Massetol mentioned that person-centered care principles are becoming more widely adopted across care contexts. As a result, there is a growing need for measurement tools that can evaluate intervention programs and help understand individuals living with dementia. Let's take Mrs. Thompson's case. She is 76 years old with medical hypertension history and Alzheimer's disease. She is a widow and lives alone and noticeably experiencing memory lapses, coordination, and confusion. Having her as an example as a nursing student, there are the, these are the health assessments needed to be performed. First, gathering information. This can be done by collaborating maybe with her family members to gather information about her past medical history, including her previous diagnosis or medications, allergies, living situations, emotional state to assess if she has signs of anxiety, agitation, and depression, and even family history of dementia. Second, physical assessment. A thorough physical assessment, such as head to toe assessment, paying attention to her gait, balance, coordination, reflexes. Assess her appetite and bowel habits or any signs of constipation, signs of incontinence, as well as checking her skin integrity. Third, cognitive assessment. To assess her cognitive faculties such as attention, memory, and language by giving her drills or exercises to challenge her thinking and pay attention to her behavior. Fourth, the functional assessment. This is to assess her ability to do activities of daily living such as bathing, dressing, eating, or toileting. Also, if she can perform more complex tasks just like managing her finances, or cooking, or driving, or using touchscreen phones. And lastly, safety assessment. It is also important to perform this to check the safety of Mrs. Thompson's home environment to identify potential hazards since she lives alone to avoid accident. At least if this is also considered, modifying her environment can reduce some risk and close supervisions can be provided. In conclusion, dementia is a complicated neurological condition with far-reaching consequences for the mind and body. It disrupts normal physiology, impacting the brain function, cognitive abilities, and overall well-being. This presentation highlighted that dementia's effects extend beyond mental capabilities, affecting also the physical abilities and bodily systems. Understanding its impact on normal physiology, brain function, and cognitive abilities is important for providing appropriate care, managing symptoms, and improving the quality of life for people living with dementia. Managing dementia requires a comprehensive approach that includes assessments, diagnosis, and treatment. Treatment involves medication and non-pharmacological interventions like cognitive assessments or engagements, physical exercises, and socialization. This will effectively manage the effects of dementia to improve patients' quality of life. And here are my references. And the last part. Thank you.